Welcome to the Clinical Cookout.
What's up, y'all? It's Auntie Kesh here, and this week we'll be talking about racism in medicine. Now, I know that's not a new topic for y'all, but we want to circle back and make sure that we are doing our due diligence by educating you. So I got some books here that I think that would be useful in knowing about the history. So first up, you have Dorothy Roberts' Fatal Intervention, and then she wrote another book called Killing the Black Body. But if you want to go a little bit further back, kind of how this first started, you can get Medical Apartheid by Harriet Washington. And also, if you want a personal experience with a doctor, a black doctor in medicine, you can also read A Black Man in a White Coat by Dr. Damon Tweedy. Now, tomorrow we will have a black doctor on to speak about some of the things, commonalities we see in medicine when it comes to racism and bias. But I also wanted to add that there are also doctors who are not of color who are absolutely aware of the things and the disparities and the issues and the challenges that black people have when it comes to medicine. So without further ado, please watch this video of Dr. Lincoln.
We have to talk about this book. I'm a doctor who considers myself pretty well informed when it comes to medicine and racism and those sorts of things. But this amazing book by Dr. Uche Blackstock taught me a lot. So these are 5 things I learned from this book. Number 1, the Flexner Report. I didn't know about this, that this was a report that came out in 1910, written by Mr. Flexner, who is horribly racist, which led to the closure of 5 of 7 black medical schools. And it's estimated today that if they had stayed open, they would have trained an additional 25,000 to 35,000 black physicians, who now currently only represent 5.7% of all physicians in the country, even though they represent about 14% of citizens in the United States. I knew about sickle cell disease, but I didn't know this much of the disparity when it comes to treatments that we have. So hemophilia, which affects about 20,000 predominantly white people a year, has 28 drugs to treat it. Sickle cell, which affects 100,000 mostly black people per year, only has 2 FDA drugs approved. And cystic fibrosis, which affects about 30,000 mostly white people, receives 3 to 4 times more funding than sickle cell disease, which affects more people. Number 3, the field of EMS, paramedics, because black people were not getting the emergency care they needed on the way to the hospital. So in the 1960s, a lot of cities had private ambulance services. They only served predominantly white communities. And in black communities, black people were expected to call the police if they needed to go to the hospital, which can be problematic, as you can see. So in Pittsburgh, a physician, Dr. Peter Safar, trained the residents in one community of predominantly black people to basically provide emergency medical care while in transit from home to hospital. This was the first mobile emergency medicine program, or EMT program, in the country. This all-black paramedic service helped to establish a training model for care that was implicated across the country. Okay, number 4, we've all heard of Tuskegee, but I did not know this about smallpox. So during the Civil War, there were smallpox outbreaks on both the Confederate and Union side, and there wasn't enough vaccine to go around. So Army leaders on both sides purposely infected enslaved babies because they would get the lesions, which then you could take the little fluid in there and make more vaccine from it. Both sides. Okay, the final thing I learned about this has to do with the very racist organization, the American Medical Association, which I've always disliked, but I did not know about this. So in 1945, President Harry S. Truman wanted to create healthcare for all after World War II. And this had enormous support until the AMA stepped in. Made up of course, mostly white physicians, they heavily lobbied against this because they thought it would be bad for profits. They have spent hundreds of millions of dollars from then and even now to stop this, which means that people do not get the health insurance they need, and this definitely affects people who are black and living below the poverty line more than people like me. This book is a must-read if you are in medicine, if you are considering medicine, if you just want to be more informed. Highly recommend it. Dr. Blackstock, thank you for writing this.